Welcome to the Thames Valley Cancer Alliance Health and Wellbeing series. Our sessions are developed and delivered by health and wellbeing professionals from hospitals and other health providers working in cancer services across Berkshire, Buckinghamshire, Oxfordshire and Swindon. Today I'm joined by Julie Cracknell and Kabir Ahluwalia, who are going to talk about the Cancer Care Review, something that's available to help you following a cancer diagnosis. It's provided at your local GP surgery and it helps explore what help you might need. Hi Julie, hi Kabir. Would you both introduce yourselves and we can get started?
Hello, my name is Julie Cracknell and I'm a personalised care cancer nurse facilitator for Swindon Primary Care. My role in cancer care is to help GPs and nurses within primary care to provide ongoing improved care to patients with a cancer diagnosis. I'm also a practice nurse within a GP surgery myself.
My name's Dr. Kabir Ahluwalia. I'm one of the clinical leads at the Thames Valley Cancer Alliance. I'm also a practicing local GP and perform cancer care reviews for my patients.
Kabir, start us off today. What is the Cancer Care Review and who carries it out?
It's really an opportunity for the patient and the person carrying out the review, which is usually a GP or it can be a practice nurse who's trained in doing cancer care reviews, to talk about what's important to you as a patient.
Julie, part of the reason we're doing this video today is that patients don't always know enough about the Cancer Care Review or even that it exists, and they may not realise that it's different to a normal appointment at their surgery. Can you go into that a bit?
You may not be aware, but after a cancer diagnosis, you should be offered support from your GP or nurse within 3 months of your diagnosis and a full cancer review within 12 months. At this review, you can express any concerns around any aspect of your physical, emotional, social or financial situation. You may want to know where to access help locally or simply just allow yourself to talk and vent your feelings.
And I know you see patients for their cancer care reviews, so it would be good if from your experience you could set the scene for our viewers, maybe acknowledge where people might be in their cancer journey, why the cancer care review is so valuable.
If you've received a new diagnosis of cancer, you've probably already embarked upon a journey of uncertainty. You may have experienced anguish whilst waiting your 2-week wait appointment, gone through some quick diagnostics and received a diagnosis out of the blue. You may have started treatment or even ended it, or had some surgery. Whatever your journey has entailed, it's likely to have been quick, involved a huge amount of appointments and healthcare professionals, and not allowed you time to reflect on what's happened. It may be now that you've been discharged from your hospital care and treatment that you've had time to reflect upon your journey, and this may have left you feeling very isolated, angry and upset. You may feel like you've lost some control within the treatment phase of your journey, and you may want to take that back.
And Julie, what would you say to people who think, well, I've been discharged, I just have to get on with returning to normal? So, you know, people who might not realise there's more support out there.
You may be facing a good prognosis, but are struggling with some of the symptoms arising from the cancer or the treatment. These can all be discussed with your GP or nurse, and please don't feel embarrassed if you need to talk to us around relationships, sex or money. We found around 50% of people have unmet needs after a cancer diagnosis, which can be easily addressed if you talk openly about what may be concerning you.
And what other practical advice might be useful for people to know, and what additionally can they expect from the cancer care review appointment?
You may not know, but any prescription charges will be waived for you whilst you are having treatment or experiencing effects from cancer. Your GP will encourage you to keep active, and this may reduce the effects of fatigue, but also helps you to live a healthier life and reduces your chances of the cancer reoccurring. You may want to join a local group to reduce your feelings of isolation whilst keeping active. You may be returning to work but need some help to restrict your hours to enable a phased return. You may also want to restrict the physical demands of your job, which your GP can do via a Med 3 certificate. You may not have understood the prognosis given to you at the hospital or want to know more about it, and you should discuss this with your GP.
Can you talk a little bit about how people can prepare for that conversation?
You should have been given something called a holistic needs assessment at your hospital, sometimes called a concerns checklist. You can use this to help guide your conversation with your GP or nurse. If you feel embarrassed about some aspects of your health, you can write your concerns down and pass them to us at your appointment. You may have been given the details for Macmillan. It is important that you use the resources available to help you to live better and access support from home.
Thanks, Julie. We'll include a link to the Macmillan Concerns checklist in the description for this video. So Kabir, so often the GP is the first port of call for people, but part of what you can do at the appointment is to provide access to lots of other health professionals. Can you talk a bit about some of the help out there that our viewers might not know about?
An example of this would be social prescribers, who are essentially link workers who have access to lots of resources in the community and can signpost you to these resources. It's almost like citizens' advice, I guess, but really with having that insight into healthcare resources which can be useful for patients. Alongside the work that the social prescribers can do for you, we also have a lot of other resources available provided by Macmillan, who can signpost you at your local hospital at the Macmillan Centres to health and wellbeing events. These events are catered around education around various impacts and aspects of cancer care. This includes things like fatigue, as well as trying to improve your general physical well-being, such as improving exercise, as well as things like diet after a cancer diagnosis.
And I know you've also carried out a number of cancer care reviews yourself, and out of that can often come referrals to other sources of help. Can you give us an example of an issue that you've been able to help a patient with by referring on?
I wanted to bring up an example of a patient who I had seen with regards to a cancer care review and an intervention which was useful for them. We had a patient who was complaining of weight loss as a consequence of their cancer treatment. It was chemotherapy they had undergone, and they found that their appetite had reduced during this, and they were quite concerned by how much weight they had lost. They were quite keen to put on some of that weight, and we obviously discussed some of the lifestyle factors which can be helpful to gain weight in those scenarios. But what the patient particularly found useful was the referral to the dietitian. This allowed them to get specific advice on the sorts of foods which they should buy at the supermarket and they could cook, which would really help them. And this patient really found that useful. So that's an example of weight loss, but there are also other examples, such as managing tiredness after treatment as an example, and specific symptoms which may be related to particular cancers.
And just acknowledging that obviously COVID-19 is still with us to some degree, how can people access their cancer care review if they're worried about coming into the surgery?
COVID-19 has obviously been with us for a few years now, and it's likely that there will be an impact of it on an ongoing basis. We understand some patients may find it still uncomfortable coming to our practices, particularly if they're undergoing certain treatments which may affect their immunity. We will be as flexible as we can possibly be to try and make things work for you and do what you're comfortable with. This may mean that we have the cancer care review remotely, either via video link or via telephone, but we would hope to also to be able to do some cancer care reviews in person for patients who are happy to come in.
And just to round off the talk, Kabir, can you leave us with a message that gets across the essence of the cancer care review?
What used to happen and what patients used to tell us is that doctors would talk about what they thought was important and not really address the issues which are important to you. The whole point of a cancer care review is for your healthcare professional to listen to what's important to you and personalise your care to your needs.
And Julie, do you have a message you'd like our viewers to take away today?
Whatever you are experiencing at this time, there is help available that you can access via your GP surgery. It is important that you get help when it's needed and not to feel like nobody is there for you.
Thank you both for being here today. We really appreciate your time. And thank you for watching. We really hope this has been useful. You can find a link to the Macmillan Concerns checklist that Julie's mentioned, as well as a link to the general information and support page. And we'll also include a link to one of our other videos on the holistic needs assessment that Julie refers to. Please leave us some feedback in the comments. We'd love to hear your thoughts on this talk and subjects you'd like us to bring you. To find out more about the Thames Valley Cancer Alliance, please visit our website. Details are in the description for this video. You can join our mailing list and also find information on how you can get involved with the work that we do. Thank you again, and we look forward to bringing you more of the information you want to see.